Okay. Okay. All right. This is Toki from Medical. Just doing a live about reduction technique on dislocated joint. Uh, just talk about a couple of things. My name is Toki Nakazawa. I've been working for high school setting for over 20 years. Uh, Last 2020 October, I resigned my position as athletic trainer. I'm doing social media marketing, uh, promote my own product. I do workshops. I go to do demos and to athletic training program. Also, emergency medicine programs and some medical simulation center. Uh, little bit about myself. I was born and raised in Japan, and I came to the United States when I was 19 years old to become an athletic trainer. Uh, that was my big goal. I could not speak English at that time, so I had to learn English. It spent about 1 year, and then after that, I started taking regular classes, and then I spent 4 years undergrad. I took a test as a trainer in the state of Texas. I passed the test. I came back for grad school. I finished in December '99, and I got a high school job in San Antonio, Texas. I was at Breckenridge High School, and I worked for 14 years. And then after that, I shifted to a different school district in town. I worked for 6 years. And then 2020, like I mentioned before, I resigned my position as a athletic trainer, and I started, focus on my own business, and this is what I do. How I came up with this idea, because I was a rookie at one point, there was no way to practice reduction technique of dislocated joint. Every actual practice is every actual reduction is the practice, which means there's no way for you to know. There's nothing you can do. You don't have any control. So, you know, I wanted to improve my clinical skills. So I was like, you got to be something like CPR monitoring. So I started looking, could not find anything. So I decided to, one day I was drunk, to be honest, and it's, I'm going to make my own. So I did it. Uh, at first, I started, drawing the problem. I knew that problem. There was no way to practice reduction technique. So how can I solve that problem? So, like I said, simulator, like mannequin. And so then, okay, so what can I do? So I start drawing pictures, and I pick shoulder because you see the shoulder is the most common dislocation, over 60% for entire body. So I did, okay, decide to pick shoulder, and then start drawing. And first one, I wish I could show you the picture here, but I don't have way to do it. But anyway, so I went to Home Depot, Lowe's, Home Improvement Center, and then trying to find material to use. And finally, prototype was made, approved by the doctor in town, and I started calling a lot of companies. And finally, this company, decided to take a chance with me, so I did. His company goes Sawbones, and then 2011, finally, shoulder-dislocation later was created, and we start marketing, selling for the Japanese market actually first, and then there was a huge change in the curriculum at the university level. So I came back to US market 2018, and then started doing social media marketing. I went to a conference 2018 in ATA, and I got a little feedback, and then people start buying it. So, and last year, elbow model was launched, and now I'm working on ankle dislocation simulator with the big toe dislocation simulator combo. And next one is the finger dislocation simulator. Uh, so, and then the hip might not be the athletic trainer setting, but I have a little request from the Florida retirement destination, also from the military. So it's already approved. It's just I'm just waiting for the funding. So uh, so talk about dislocation. People ask or mention, make a comment. You reduce without X-ray. My work setting, yes, I do. Uh, when I use work for high school setting, there's no X-ray machine at the school level, stadium, nothing. Unless if you're university, big D1 maybe, but who has one? So uh, I have steps before the reduction. Actually, I have a YouTube. One of the videos is talking about those steps. If you want to watch that, and I have a couple of different ways. Also, I have a YouTube video, so watch that. Uh, so elbow dislocation. Like I mentioned, there are steps, and I'm just showing just the technique only. Okay, so it's dislocated as you see. Okay, one way is counter traction. Oops, it's reduced. Okay, so is this works every time? Not really. Okay, because some uh, athletes are really big, and if you're not strong, you cannot do that. That technique does not work. So, but if you're strong, if you're a big guy, then you can. So that technique is not for everybody. Okay. Another technique, well, you can use is actually face down technique. Okay. Put the patient on the table, exam table, elbows at the edge of the table, and then use one hand to hold it. Okay, and then you traction down. Uh, you can do with one hand traction down, or you have somebody to hold the arm, and then you use both hands traction down. You can do that too. So, or face up technique. Patient facing up. Use your body weight, okay, and then traction up. So you can do that too. Okay. Uh, the sooner you reduce, it's easier to put it back. So then reduce, patients suffer less pain. So then reduce easier, and also faster recovery. I wish on the high school level you really cannot reduce right away because they're underage. You have to talk to the parents first or guardian, and if they say yes, then do it. If you don't, then reduce. You might get in trouble. Uh, so, well, just talk about finger dislocation. Then, uh, finger dislocation. Let's say playing basketball, trying to catch the ball hit the tip of the finger, and then dislocate. Okay, so how you gonna put it back? Push the end of the bone, and then wrap around the tip, and then push and pull at the same time, like that. Okay, so uh that would be it. So uh well, I got no views, huh? All right, thank you.